once tennis elbow has been present for 4 weeks, roughly a month, it pretty much doesn't matter what you do as far as resting or icing or massaging, even taking anti-inflammatory medication typically will not get rid of tennis elbow. Hi, I'm Dr. Lieber from Regenexx Pittsburgh, your non-operative interventional orthopedic specialist. So for the most part, once it's been around for a month, you're going to have to do something more than just hope that it will go away, because it just will not. So if lateral epicondylitis or tennis elbow goes untreated for a long period of time, you can have really debilitating elbow pain that precludes you from doing even simple activities such as shaking somebody's hand, let alone not being able to play the sport you want to play, such as playing tennis, which is where the name came from. So it can become a debilitating process. And whenever pain becomes debilitating, it can affect other areas such as your shoulder, your neck. You can compensate because you're frightened to use your hand in a way that will provoke the pain. So it can become a more significant problem than if you were to address it by having it treated.
So let me tell you a story about one of my golfing buddies, Al. Al came to see me because he had severe lower back pain with pain radiating into his left leg. He wasn't able to play golf and he was considering surgery for his lower back. I talked to Al, I looked at his MRI, and I said, Al, you don't need to undergo surgery. I can get this better for you. We did a platelet-rich plasma procedure to his lumbar spine, and 6 weeks later, Al was back to playing competitive golf, and he won the senior championship at his country club. Al was so happy with the procedure that he underwent with me, and was so happy that he never had the surgery. So are you a golfer, and are you looking to avoid surgery? Do you want to continue to play competitive golf? Come to see us at Regenexx Pittsburgh, where we have non-operative solutions to help get you back in the game.
There are many patients that we will see here at Regenexx Pittsburgh that we treat their tennis elbow. Typically, they've had tennis elbow for several months before they come to us. Typically, they've had one cortisone injection in the area before they've come to us. Occasionally, they'll see an orthopedic surgeon who will recommend a release of the muscle that attaches to the bone. Most importantly, they'll come and they'll have platelet-rich plasma injection under ultrasound guidance into the area of their tennis elbow, treating the tendons, treating the ligaments in the area. Ideally, you would come to us before you had gotten a surgical recommendation or before you had received a cortisone injection, because we have a treatment which is non-surgical with small needles where we're going to inject your platelet-rich plasma and help restore your function and get you out of pain without the debilitation of a surgical procedure and without the unnecessary side effects of a cortisone shot causing atrophy to the muscles and soft tissues in that area. It takes time for them to get better, but I would say most people get better significantly somewhere between 3 and 6 months. So it takes time for that tissue to heal effectively, but most people are able to get back to the sport or the activity that they want to be able to perform. Occasionally, we'll need to use bone marrow concentrate if the tears really are quite large. But 98% of the time, that treatment with bone marrow concentrate is unnecessary. And most of the time, one and done. You don't have to do this multiple times. I would say the vast majority of the people that we treat have a resolution of their painful symptoms and restoration of their function, going back to the activity that they enjoy after undergoing one platelet-rich plasma injection. So the name is tennis elbow, and it's synonymous with the medical term lateral epicondylitis, but most people that we see here at Regenexx Pittsburgh aren't tennis players. So anything that stresses the muscles that attach to the bone in that outer area of your elbow can cause tennis elbow. So you can be using your wrists and hands repetitively at work and get tennis elbow. This is usually a repetitive use trauma to the area, so it occurs over the course of time. Sometimes you can have direct blunt trauma to the area. Funny story, when I was first in my residency, the attending physician who was treating or who was lecturing on tennis elbow went and firmly pressed on the outer aspect of my elbow for several seconds. And as a result of that, I had several weeks of discomfort in the area of my lateral epicondyle. I didn't play tennis, but so you can have traumatic events, you can have overuse events with your hands and wrists, which lead to this problem. And more often than not, it's occurring not because you're playing tennis, but because you're overusing your wrists in such a way that it causes that condition to occur. Even people who grip tools repetitively, particularly maybe they have to use big wrenches, are prone to getting tennis elbow.